Hey, everybody, and welcome to Autism Awakening, the podcast that helps you help your child with autism. Today's podcast, today's Facebook Live is going to be a great one. We have a wonderful guest, Dr. Erica Peirson. She is an amazing physician. She's worked at the Shriners Hospital. She's been in our autism community for over a decade. She's trained with MAPS. She's now becoming a regular at TACA. And her specialty, not only helping kids with autism, is also helping kids with Down syndrome. And Dr. Peirson has a child of her own with Down syndrome, so she has become an expert, as all parents have, when they need to help their child. So super happy to have Dr. Peirson on with us. Hey, Dr. Peirson.
Hey, thanks, Dr. Skowron.
So we're getting some people on here live, which is great because after we talk with you, we'll have some questions and answers. But I wanted to tell everybody out there who's listening, either on podcast or our YouTube channel or later, that we record these live Thursdays at 12:15 p.m. Eastern Time on our Facebook page. So if you ever want to take part of a live recording of our podcast, you can come on our Facebook page, ask live questions, and we're just here to help you guys. So, Dr. Peirson, where do you want to begin? What do our families need to know?
Well, I mean, you know, our main goal today, I think, is talking about children with Down syndrome, right? And what I've learned in helping them, which is where I started my career in this area, extends to our children with autism, right? Because they experience similar things, mitochondrial dysfunction, gut issues, etc. And I think that's where I always like to start when I talk about my patients with Down syndrome is that they are experiencing these things that our children with autism are that are actionable. It's a really important word that I use. We're looking for actionable things. We can't change the genetics, nor do some of us don't want to, right? Many of us don't want to. And so, so we're looking for actionable things we can do. What can we do to optimize their health? And really that extra chromosome only makes up 1 to 1.5% of their entire genome. It has far-reaching implications, right? Obviously. But when it comes down to it, there are, 99% of them is other genetics, and even more beyond that, dictates their health and their neurodevelopment is the environment, right? It's the classic question of nature versus nurture, right? How much of us and our health is dictated by our genetics? I know you talk a lot about genetics. We talk a lot about SNPs. They're important. They play a role, of course, but as naturopathic physicians, we always take into account diet, the environment, our exposure to pharmaceuticals, our exposure to toxins, the words our parents speak around us, our expectations as a child, right? Play a huge role in the development of our children, and the same is true for our children with Down syndrome. All these things play a role in their health, and they're all unique. They're all unique, right? I'm not a fan of protocols that treat all of our children with Down syndrome the same, because they're not. All you need to do is put them all in a room and you'll see, right? They're all unique. They have unique personalities. They have unique health backgrounds, unique births, I mean, it's just incredible how many things are unique about them. So that's my biggest approach, right? I treat them as a child first and respect and honor their unique qualities, not only in their personality and their lives, but in their, biochemistry. And so, with that approach, I use many of the same functional labs that are used to help children with autism. I screen to make sure that they are not experiencing vitamin deficiencies, gastrointestinal issues. And we often find these things, right, in our kids, especially gastrointestinal issues. Those are very common in our children with Down syndrome, as they are in our children with autism, right? Very common. And what I find, so I've seen thousands of kids with Down syndrome now, all over the country and all over the world. And what I see over and over again is these very common, not all of them, but very common gastrointestinal issues, I believe, are playing a bigger role in their health and development than possibly even that extra chromosome itself. I honestly do. Yeah, exactly. I honestly do. Right. And so we know that there are individuals who have the full trisomy 21 in their genetics, and they've gone to college, they're living independently, they're on television, right? They're giving TED Talks, they're doing remarkable things, right? They have the extra chromosome. Why is it that we have a certain number of, percentage of children in our Down syndrome community who are significantly struggling, right? And that's what I want to understand. That's where my practice is, right? How can we get, what's going on with these kids that are really struggling? And what I find is higher rate of gastrointestinal issues, higher rate of nutrient deficiencies secondary to those gastrointestinal issues, right? And what often happens is, because they have this diagnosis of Down syndrome, is that this tendency for healthcare practitioners to do what's called diagnostic overshadowing. Have you heard that term? Yeah, many parents haven't heard that term. You've heard it. It's where the tendency for healthcare practitioners to attribute all of their healthcare issues to their primary diagnosis of Down syndrome. And that's it. It's just Down syndrome, right? They're not walking at 4. They're not talking by 10 years old. They're not, they're constipated, no bowel movements for 10 days, etc. That's just Down syndrome, right? I call BS, right? And so this is where when we dive deep into their biochemistry, these, vitamin deficiencies and other things, mitochondrial dysfunction, things that we can take action with through diet and supplements, rarely, but sometimes, pharmaceuticals when warranted, we see great improvements in their health, right? It's challenging, right? The work you and I do, it's not easy, right? It's easy for me to type a treatment plan, and then the work is up to the parent, right? I commend all of our parents for all the hard work they do in our kids, but man, the reward, the payoff, right? And again, the same is true for our kids with Down syndrome. So there are a lot of tools that we can do to help our kids that we can use. So gut issues, right? If I could go deeper there, right? You talk about gut issues, I'm sure, on your, podcast here.
Yeah. And before you do, I just want to interject. I
Please.
love that you brought up diagnostic overshadowing, because it happens with our kids with autism. And how many times does a parent bring a kid to a doctor and be like, oh, that they're screaming? Well, that's just the autism. It doesn't have to do that they're in pain or have some autoimmune disease that they're dealing with. So and I've seen the same thing with Down syndrome. I've run thyroid tests and the TSH is a 20, and the doctors say, yeah, well, it's Down syndrome. We're not going to help them. And that's where our kids suffer.
Right, exactly. There's actually, I think, a paper that some doctors refer to that say a TSH as high as 10 is normal in Down syndrome. And so they refer to this paper and they say that's our guide, that's our guideline. There are a lot of examples. We have a separate growth chart for children with Down syndrome. Yes, growth is, challenging for our children, but when we look at, some deep causes of that, it's gastric malabsorption, hypothyroidism that's undiagnosed, methylation issues. Growth is very challenging for many of my kiddos, but they have a whole separate growth chart that allows and permits doctors to say, well, they're normal on the Down syndrome growth chart. And so I even see diagnostic overshadowing in research. Recently, in the last year or two, came out that said abnormal values on a CBC are normal in children with Down syndrome, right? A high MCV, a low white blood cell count, etc. And I find that when we do the work, that we do, that these can be improved, right? And look, I'm not sugarcoating things, not making false promises to parents, right? Another key word here that I like to use is optimizing. Right? We're just optimizing. I want to get these kids who are really struggling on the lower end of things and really struggling in their health up to, where the kids who are doing better, right? Healthier. So yeah, another key word I like to use outside of actionable right? Diagnostic overshadowing is important. There are medical tendencies in our children with Down syndrome. They're all different. They're all unique. There are tendencies, right? Just like any other kind of, genetic thing, men, women, right? We all have our kind of medical tendencies, higher rate of heart disease, lower rate of whatever, So, so it's these tendencies that I use that I screen for, right? Methylation issues, very common in our children. There are several genes on the extra chromosome that play a role in that methylation cycle. CBS being one of them, it's on the extra chromosome. So in theory, it's upregulated 150% because we have 3 copies, right? But our genes don't just sit there like a ticker tape machine, dating myself here maybe, and just spew out enzymes and proteins, right? They are controlled by the environment, right? So I don't make assumptions that that CBS is running an overdrive. I run tests, right? We look at the intermediates of the methylation cycle as much as we can, right? Homocysteine, I look at an MCV, I look at histamine levels. I mean, what else do we have for methylation? I just look at serum B12. It's complex methylation, right? So that's one tendency I look at, and I try to optimize as much as we can. Common deficiencies include zinc deficiency, very common in our kids, but I've seen copper deficiency, right? So I don't assume and just give them all zinc, right? We test, right? That's my approach. Other common deficiencies are B vitamin deficiencies, right? Very common in our kids, kids with autism as well. And again, I keep malabsorption, right? Things like SIBO, small intestinal bacterial overgrowth, yeast overgrowth, right? Very common in our kids, especially the yeast, right? They're given many rounds, so many antibiotics. Jared, I have had some appointments. It's a question on my questionnaire, on my intake form. I'll see 3-year-olds who've been on, I am not kidding, 15, 20 rounds of antibiotics in their life for a 3-year-old, right? They have a research model for this in mice. They're called germ-free mice, and they're not healthy, right? These little mice, so if we deplete the microbiome with antibiotic after antibiotic, that's going to take its toll. And our kids with Down syndrome experience a high rate of antibiotics for their, common ear infections, etc. So these gastrointestinal issues, right? Often coming from, right? What would kind of start this ball rolling of these gastrointestinal issues? Low muscle tone, right? This plays a big role, and this is where I help other children with other genetic conditions. So now I'm known for helping kids with genetic conditions, and I could list the number of kids that we've helped with other genetic conditions, because low muscle tone is common with several other genetic conditions, and our kids with autism. And so low muscle tone will affect gut motility, because from medical standpoint, from tongue to anus, our gut is all muscle, right? The esophagus, the stomach, right? Those 3 layers of muscles churning and moving food and bacteria through our GI tract. And if that rate of bacterial growth and normal activity does not match the rate of motility of the muscles through the GI tract, we'll get an imbalance and an overgrowth of bacteria. Not even a pathogenic, right? We're not talking about pathogens, which do occur. Just regular gut flora overgrowing in the GI tract will cause malabsorption. And then that malabsorption, especially I see thiamine deficiency a lot in our kids, malabsorption will result in a further decline in mitochondrial function, nervous system function, more low muscle tone, vicious cycle, right? So I made a diagram of this years ago when I was really doing some deep about my work. I was like, am I fooling these families? Am I really, what am I really doing? I remember it distinctly, where I did a mindset shift, right? Is it genetics? Is it environment? Can I really do this? And I made this diagram that showed this vicious cycle And when I kind of stood back and looked at it, I was like, that's my work, right? Just getting into the gut microbiome. There's more work, there's more in-depth stuff that we do, but that's a big part of it. So yeah, so that's a big part of it. Looking at their gut health, taking into account the extra chromosome and the role it plays. So I like to run labs, right, to see what's going on with these kids. I'm not going to throw the kitchen sink of supplements at them. There's a place for trial. Absolutely, there's a place for trial of supplements. I've recommended several of yours to families, of course. But testing, right, just blood labs, iron levels. Just this week, I picked up in 2 newborns with Down syndrome, a ferritin of 6 and a ferritin of 9. Just this, right? And nobody had screened. I think one was 11 months old, and I was like, nobody's screening for these things. In all of our kids, they need iron screening because it's one of the #1, global, nutrient deficiencies, right? So just screening for a ferritin, just, our body's storage form of iron. And though that has long-term IQ implications if it's missed, that would then be just attributed to, oh, they have Down syndrome. So we work to correct that, right? Give them a little bit of iron, figure out what's going on in the gut that's maybe interfering with their iron absorption if they're getting it in their diet. So blood labs, I look at serum zinc, copper, B12, as much as I can, each blood draw, depending on the blood volume I can get from a child. I do a lot of organic acid testing, of course, right? One of the #1 tests, I think, in our field. And this is where I started to see, the duh moment. Oh my gosh, they're all different, right? With especially through organic acid testing, and stool analysis, of course, right? As you have yourself, I'm sure, picked up some very surprising things on stool analysis that you can't see, right? How many times do I just want to kind of dive in and look at what's going on in a kid's GI tract? We can't, right? But we've got some really good GI stool tests on the market today that give us some really good information on, digestion, microbiome, presence of pathogens, parasites, yeast, etc. Sometimes I'll do, if you're curious, I'll do sometimes some urine neurotransmitter testing. Has its limitations, but gives us some guide on the peripheral presence of neurotransmitter processing within the body. Doesn't test the central nervous system, can't do that. But again, finding some very interesting results that help guide treatment. Yeah, and there are others. Sometimes I'll do a hair analysis testing. Of course, not in my mind, not perfect as well, but if something's way off, it can be a guide. Oh gosh, and folate receptor antibody testing, right? Very, very interesting new frontier in our field. As you know, and your audience probably knows, 70%, right, of children with autism, what they're finding, have these folate receptor antibodies blocking their brain, folate from getting into their brain. I'm finding a high rate of that in our children with Down syndrome as well, Jared. I'm hoping to work, publishing research, right? It's a big undertaking, and I'm running into some challenges, but I hope to someday publish a paper on the prevalence of these antibodies in patients with Down syndrome. I'm seeing in my practice, I've done, gosh, not many, less than 10, right, on my patients with Down syndrome. Blood draws are tricky. Getting this folate receptor antibody test has its obstacles too. You can't just go to LabCorp and get it. But all of them have come back positive, right, so far, especially in our kids with Down syndrome. Have you ever heard of Down syndrome disintegrative disorder? You ever heard of this or experienced it? So this is an unfortunate occurrence that happens in our patients with Down syndrome. For many, it happens around puberty. So there's something hormonal possibly going on. I think the average age is, I've read papers, somewhere around 11 to 17. and it's where they become almost catatonic, right? And it can almost be one day to the next, and they're kind of gone. It's really unfortunate, and these families are struggling significantly, and those are the kids I'm finding these folate receptor antibody tests. We've gotten a couple kids back to baseline, right? We got them back, right? With this high dose folinic acid. One kid had a gut infection. I think it was a Proteus mirabilis. Treated him with uva ursi, an herb, right? And the sooner we catch it, the better, right? We get, as you know, with all of our work, if parent comes to us and their child's been experiencing something for years, it's challenging. We still dive in and we, try to optimize everything. But the sooner we catch this sort of thing, the better, and screen them for all these nutrient deficiencies, gut health issues, folate receptor antibodies, the higher likelihood that we'll get them back and, optimize their health. Yeah. As with any of us. Yeah. So that's been really interesting. As you've experienced, and I've recommended, you've got a folinic acid powder, I think. Yep. Yeah. Some of our family's been using that. So those are some key areas. I could talk about some more areas. I haven't even been looking at the time. Some key areas of health, but yeah, I can go on.
Well, time goes fast because you know so much, and I love that you focused on science and lab testing, and that's just a way for us to understand how we can help our kids. And obviously we live in a medical society that has very small protocols that aren't comprehensive, and they aren't thorough, and they're just not doing as much as they can for any child. I mean, any child can have iron deficiency, and these things are simple and basic and obvious. It's just not part of conventional medical protocol, and that sucks. That sucks for our kids. But it would also interest me that you talked about it's this vicious cycle. You're born with let's say you're born with just poor mitochondrial function and poor motility. And with the poor mitochondrial function comes a weakened immune system. You get the chronic ear infections, you get the antibiotics, and it spirals and it spirals and it spirals and it spirals. And then, then you're in a place where you go to the doctor and they're like, well, I guess you have Down syndrome. And there's so much that we can do to help. And for us, it seems basic because we do this every day. But it's the basics of understanding how the body functions, what the body runs on, and making that function correctly. We're not here to change the DNA. We're here to make the body function and the child function as well as we can. So
yes,
I think the other thing I wanted you to get into before we get to our questions is kind of talking about Down syndrome and thyroid.
Yeah, that's where I started my career in helping these children. Was I saw the very obvious need for thyroid testing. And when I learned about that, we didn't learn in med school, when I learned about the more in-depth analysis of thyroid hormone, not just looking at TSH and T4, and I can do my quick elevator speech on what all these labs are, but TSH and T4, but also looking at T3 and reverse T3, right? Really needed in our population of kids with Down syndrome. So when I started learning about that, and reading about, it's kind of controversial in the Down syndrome research community of how much of their physiology is hypothyroidism, how much is just Down syndrome. I mean, the list of symptoms just match, right? Poor growth, constipation, bloated bellies, cognitive issues even, right? That it's just Down syndrome, but thyroid hormone can play such a role here. And so when I do it, I always, very rarely do I not test reverse T3. If I've got a repeated, I'm doing them repeatedly on a patient, and reverse T3 is always normal, I might not repeat it again. But I almost always do TSH, T4, free T3, and reverse T3 to get a thorough assessment. And I can explain what those are for your audience if need.
Yeah, why not? And I'd also love to know, while you're explaining, if you get into analysis of iodine versus halogens and how that affects function, even when the hormone's there.
Yes. So, so TSH comes from our pituitary gland, sits right in the center of our skull here, hangs down from the brain in this bony pocket. And I mentioned this called the sella turcica, of course. I mentioned this because there's some anatomical differences. In our children with Down syndrome, that bony pocket can actually be shaped differently. I have a social media post on this. And that will affect the function of the pituitary gland. So knowing this alone, right, we're also looking at growth hormone and other hormones coming from the pituitary gland, but it can affect TSH, which comes from the pituitary gland, gets into our bloodstream, docks onto the thyroid gland like a lock and a key, triggers the thyroid gland to secrete T4 hormone, which has 4-iodine on it. Basic math we're talking about here. T4 feeds back to the pituitary gland in our bloodstream, triggering it to adjust the level of TSH that comes out based on the level of T4. As we learn in med school, right, same as your thermostat in your home, adjusting the heater based on the temperature you have it set at. And so we get this negative feedback loop, right? This nice kind of balance of things just flowing regularly, but that's only looking at TSH and thyroid right here. The rest of our body, our brain, every single cell in our body needs T3 hormone. That's the active thyroid hormone. T4 hormone is considered a pro-hormone, right? It's a precursor hormone. Has, for the purpose of our lecture today, I'll say no function in the body. One of those iodines has to come off. And it's the outer ring, that iodine that is removed, that makes it T3, active thyroid hormone, and this happens on the cellular level of the body. The inner ring iodine can be removed by these different deiodinase enzyme that will make reverse T3. And that difference of removing which iodine do we remove, which deiodinase enzyme is used and upregulated, that's dictated by the environment. It's dictated by stressors in the body. Low calorie intake or malabsorption, right, will result in a higher reverse T3 level. Toxins, stress, all sorts of things. It's kind of why conventional medicine, I think, doesn't look at reverse T3, because it's not, there's no drug for it, right? Right? It's a whole kind of system analysis of the environment and the body that I don't blame these guys, right? They don't, you know, you can't do that in a 10-minute doctor's appointment. It's a systems issue. So, so it's really important for our kids to look at that reverse T3, free T3 ratio. But we also do see low T4 levels, right? Low T4, right? T4 hormone, of course, needs iodine to produce it, to be produced. And so we do see iodine deficiency in many of our kids. I'm not a big fan of mega dosing iodine. Personally, in my practice, I've seen that backfire with TPO shooting up to 30,000 in a kiddo when they got lots of iodine. Yep, seen it. And that always has to be balanced with selenium, of course. And of course, studies show that selenium can be lower in our kiddos with Down syndrome. It's needed for glutathione peroxidase and all sorts of important things. So I will use iodine, certainly on occasion. But a lot of things are involved in T4 production. Iron is needed. Zinc is needed for T3 production. Certain vitamins, I think B2, B6, B12 maybe. But I look at, if I have a parent who does not want to start their child on a hormone that they may need lifelong, we'll look at underlying causes, right? If their TSH is like 5 or 6, and which I've seen with just a cold, just a little, we'll elevate their T, and we wait, right? I don't always just throw thyroid hormone at these kids. We can correct it with underlying causes. I've seen a kid with a TSH of 10. Mom didn't want to use thyroid hormone. This was years ago. And I was like, are you sure? Because I think we need some thyroid hormone. And she wanted to do iron. And so we did, and she proved me wrong. And we got, and the TSH went down to 2. Wow. Just needed iron, right? Yeah. So looking at underlying cause of hypothyroidism in these kids is key. But boy, when they do need that thyroid hormone, because there are some anatomical difference, the thyroid gland itself can be, there can be some morphological, differences just congenitally when they're born. Those papers are out there. When they do need thyroid hormone and we give them thyroid hormone, we see some pretty big wows, right? We see some pretty big wows there with their development, their strength, their bowel movements, right? The lights turn on, right? I gave Miles thyroid hormone for a short period when he was younger, when his TSH was 4.5 or so, 5. And I pulled him off of it after a while, after a year or so. I think it was over spring break. So I could watch him, like a hawk, like we do with our kids. And he hasn't been on it since. And his TSH runs like, 1.5 to 2. And so we've gotten some kids off of thyroid hormone. Yeah, we've gotten a lot of kids. Palate expansion. Some kids just getting their palate expanded, right? Opens up that circulation, changes their breathing and their sleeping, and can even change the morphology of that bony pocket that holds the pituitary gland. So, so a lot of things we look at underlying the hypothyroidism to optimize that for our kids, for sure. Yeah, really huge.
That's incredible. I mean, just and again, I want to go back to the difference between our conventional system that is set up as a systems issue to be so fast. You're like, here, do you have a thyroid problem? Here's your TSH. Here's your hormone for life. You have to be on this for life. Goodbye. Versus those who are spending time with families and spending time with kids and really trying to understand everything, not just let me find something so I can prescribe you a med and you're out the door. And that's the difference. That's the difference of what we can do. I mean, I would never have thought I could drop a TSH of 10 down to 2 with some minerals. It's amazing.
Sure. Yeah. Look, I feel for I'm not downplaying what conventional medicine does, right? I used to be an EMT, the emergency medicine, right? We need it, right? We need it. But when it comes to chronic disease and healthcare, they fall short, right? Because there's a lot of work that's needed. And I know that many conventional doctors are frustrated too. They're frustrated too, right? That they're beholden to a standard of care, right? And if they don't follow standard of care, they get in big trouble, right? They could literally lose their license. We've got a bit more leeway in our practice, in our field, fortunately. And so yeah, there's shorter appointments, right? Standard of care, algorithms, guidelines, right? They've got to follow all this. Even though there's a plethora of research and information. I mean, it's just kind of overwhelming, the amount of information that we have access to help our kids, that they just can't access, right? Unless they decide to completely leave, the field. So there's a place for conventional medicine, right? I often coach my families to, go see your primary doctor, go see your nurse practitioner, make sure they're looking in their ears, make sure they're checking their reflexes. And I'll even coach my families, here's how they should be checking their gallbladder, and here's what you should be seeing, right? Because I don't have time. I know, when I worked in conventional medicine at the hospital, things went quickly sometimes. And thorough physical exams, aren't always done in a short visit. So I'll coach my families on, how to make the most of that 10-minute, 15 minutes with their doctor, and questions to ask really quickly. So I do a lot of coaching, on how to manage the conventional, model. Yeah, so it's tricky, but there's a place for them. There's a place.
Oh gosh, yeah, and as we know, they're great in the acute situation, but chronic illness needs more time and more understanding. So that's what you're trying to do.
Yeah, it's definitely where we come in. But even something like, ear infections, right? I mean, I see patients telemedically, right? So if a patient is just like really congested, tugging on their ear, I say, go have them look in the ear. We need it looked at. I did have one patient who got mastoiditis once, right? So ear infections can get serious, but but we have tools, right? We have tools, naturopathically and otherwise, to treat it without antibiotics. Doesn't always need antibiotics, right? You want to watch it closely. Sometimes it can get serious, but more often than not, you can use, eardrops and removing dairy from the diet, and so many other tools we can do for just ear infections alone. Yeah, 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 yeah.
It's awesome what you've done for so many families and so many kids. So thank you.
Yeah, thanks. Thanks. Yeah, it's fun. Challenging, but fun.
It
Yeah.
it is.
Mhm.
It is, and that's why we've been doing it for 2 decades.
Yeah.
And I didn't mention at the beginning, Dr. Peirson and I went to the same school and we're friends at school, so we've known each other a long time.
Yes, indeed, indeed. Yeah. And today is my son's 17th birthday. Yeah.
Happy birthday,
So I'm
Miles.
very reflective on my career for sure. This is good
Yeah.
timing. Yeah.
Kids do that for us. They give us those little time markers.
Yeah. Yeah, for sure, for
For
sure.
sure.
Yeah.
So, before we move into the live questions,
Mhm.
what's, I want to mention that, for everybody listening, Dr. Peirson does have a telemedicine clinic. If you have a child with Down syndrome, go see her. People who come see me in my practice, I refer them to Dr. Peirson. So child with autism, child with Down syndrome, Dr. Peirson has a telemedicine practice. Her info is pinned here on Facebook, and we'll make sure we put it in the descriptions for the podcast and YouTubes and such. So you guys can get a hold of her and consult with her. But before we get to the live questions, what's one important thing you want to make sure every parent understands?
So glad you asked, because I was thinking there was one really important thing I didn't mention. The number one thing we do for our kids with Down syndrome, diet and exercise. I mean, it's so simple, right? It's so simple. I have an interview on my social media post where I interviewed Karen Gaffney. She's one of the examples of TED Talk, college, full high school diploma, not a specialized one, 2 years of college, works in a law firm now, doing wonderfully. I interviewed her. She never took a supplement in her childhood, right? Never took a supplement, right? So, and I asked her, and she says diet and exercise. She's incredibly healthy, always was a swimmer, swam the English Channel with a team, and always a swimmer. So you can't out supplement a bad diet. Love that, right? You know, and so just diet is so key. It's hard for a lot of kids to eat their vegetables and all that stuff. It was never an option in our family. I mean, it's kind of a cultural part of your family culture in a way, right? I mean, it's almost religious in our family, right? The vegetables, the healthy lifestyle, right? And so yeah, so diet and exercise, right? Gluten-free, dairy-free, lots of vegetables, grass-fed meats, healthy fats, right? I mean, full on, right? Um, so yeah, really important for our kids, important for all of us, kind of extra important for our kids with Down syndrome who, we're looking to really optimize everything. So yeah, diet and exercise. Yeah.
Yeah, it's the basics, and it's hard. It's hard if you don't start it in the beginning. And
Mhm.
I'm glad we did with our daughter. We go vegetables from 6 months on, and she's just turned 12, and she'll walk in and grab a raw onion and start munching, which blows my mind. But
Yeah, yeah,
it's
yeah.
you can't rewind the clock and be like, okay, I'm gonna train you and raise you this way. So it's hard to switch over, but it's what's healthy, and so it's what you got to do.
Yeah, yeah, and then the whole family's got to get on board, right? So
Yeah,
it's a mindset change, yeah,
yeah.
for sure.
They've got to watch. They've got to watch their parents do it.
Yeah, there's a study actually that when children see someone else enjoying their vegetables, and so we get into it, oh, this is so good, that they will eat their vegetables as well, right? When they see it. There's a great resource called Copy Kids. Have you seen that? If I could promote something else, there are Amazon. You can get the videos on Amazon, YouTube. You can buy the DVDs. It's called Copy Kids. It's just cute little kids eating their broccoli, and video modeling is a well-researched thing. And so Copy Kids is a good resource for your families to watch other kids eating vegetables. You better have that broccoli ready, because that kid's going to want to do what that kid on the screen is doing.
Yeah, exactly.
So
Exactly.
things like
Yeah,
that.
that's how we learn.
Things like
We repeat, we echo. I mean, that's echolalia. We hear and we repeat. That's being a kid. So
yeah, exactly.
before we go to the questions, I want to make sure everybody knows your website. What's the best place for people to reach you?
Peirson, and it's Peirson, PearsonCenter.com.
PearsonCenter.com. Perfect. All right. Let's get to some of our live questions. We've got a shout out from Amanda. Amanda says, I'm so grateful for this podcast today. We have a son with Down syndrome. He is 9. Thank you. So Amanda, I'm glad you're on. Please reach out to Dr. Peirson if you haven't already. Diane says hello. Hey, Diane. Diane says how to treat dyspraxia. So we'll both answer this one. And why don't you go first?
Yeah. Dyspraxia of speech, right? And so help me out with dyspraxia. This is where the words aren't mixed up. They're just trouble getting the words out.
Yeah, they obviously have the mental understanding of what to say, but getting that to the mouth, it's coming out difficult.
Oh gosh, so speech, right? I'm doing some really interesting, reading some really interesting papers on, well, folate receptor antibodies, number one, right? We've seen the emails I get on the response just when we do trials of folinic acid for speech are incredible, right? So folinic acid is one of my go-tos, whether it's a trial or testing for the folate receptor antibodies. It's one of my go-tos for speech. Ensuring that a thiamine deficiency has been addressed, or see if it's part of their history, screen for that. That can play a big role in speech, a thiamine deficiency. We look at Wernicke-Korsakoff syndrome and the effect that alcohol has on thiamine deficiency, and then alcohol and speech. There's a correlation there. And then really interesting research I'm reading on dopamine. Happy to, if you haven't already seen it, it's really interesting. Dopamine playing a role in speech, because we know, right now, the saying is I'm so glad this is getting out there, speech is motor. It is not an indication of cognition. Language, right, is more of an indication of cognition, your ability to, put thoughts together and, what is actually said. But speech, the motor function of speech is a motor issue. And dopamine is heavily involved in our motor system, right? When we look at individuals with Parkinson's, for example, a stutter and speech issues can be a part of that as well. And so what do I do for dopamine? Well, we're looking at the methylation cycle, tetrahydrobiopterin, possibly tyrosine. I do neurotransmitter testing. Yeah, so those are a few things I've seen help speech, and then choline. Choline I've seen help speech as well. Yeah, phosphatidylcholine, yeah.
Yeah. And I'd love to add on mitochondrial support, because if we're really looking at a motor function when it comes to the mouth and the tongue and all that, mitochondrial support can be huge. And I'm glad you brought up dopamine, because I'll often give tyrosine, and tyrosine is the protein that you need to make dopamine. I'll often give that for a lot of our kids, whether we test and we see a dopamine deficiency, which I see often. But I'll tell you, I see it really effective in girls. The boys tend to get a little hyper on the tyrosine, but the girls I've given tyrosine to, language. It's awesome.
Interesting. Yeah. Nice. Yeah. Interesting. Yeah. I'll send you those papers if you haven't seen them already. Yeah.
No, please.
They're interesting.
Please. How can you read them all?
Yeah, right. Yeah.
I have PubMed send them to me every day, and it's like I can't keep up on 10 to 20 a day. All right.
Yeah.
That looks like all the live questions we've got right now. If anybody's here listening live and has a question or anything, feel free to put it in the comments section.
Yeah.
But we've got a little bit more time, Dr. Peirson. So, boy, tell me some of your favorite clinical stories.
Yeah, so, well, more recently, right, the young man who had a clear case of Down syndrome disintegrative disorder, Down syndrome regression, right, we, got him back to baseline with some help with folinic acid and treating his gut. The recent little girl from Australia who had an incredible response from folinic acid to her speech, literally had some behavioral issues in the beginning, which is common and when you give folinic acid, but I tell parents to kind of ride it out. Easy for me to say, hard to do. And they saw, incredible speech. So I think those are some of the bigger stories I've seen. And just when I pick up a deficiency like B12, we'll see B12 in the 200-300 picograms per ml. which might be within the normal reference range, but is very low, and we give them B12, right? I mean, that's like a night and day difference in their motor skills. Again, the lights come on. Those are some really remarkable stories. And I got to tell you, Jared, it's hard for me to pick one or two cases, because in some ways this work is easy, right? Picking up a ferritin and a low B12, it's like every day I get these cases and these stories. I've got some really challenging kids, of course, really complex infections, neuroinflammation, those are challenging. But every day we're seeing, cases of kids when we screen for their exact deficiencies. And so you mentioned mitochondrial dysfunction and support, right? I like to know exactly where, right? There are many steps in mitochondrial function. And so that's where the testing helps. And I like to know exactly what nutrient each kiddo needs instead of just throwing the kitchen sink at kids. I could say I'm seeing a couple questions come across the bottom of the screen here. Somebody's mentioning low cholesterol as being an issue. I don't know if you're seeing those questions at all.
I'm not, but if
Okay.
you're seeing a question that I'm not seeing,
Yeah,
please answer it.
sure.
I don't know
And
why you're seeing them and I'm not,
yeah,
but that's
no
Facebook
worries.
for you.
I've had this problem too on this before. We're on superfolinic acid 1 week. How long do you take it? And do you see any chance? Thanks for what you do. Something about leucovorin just came by. And then another question about low cholesterol. We do see low cholesterol in our kids, right? It's a big problem, right? The brain is just, full of cholesterol. Our cell membranes need cholesterol for rigidity. We need cholesterol for vitamin D and hormones, and cholesterol is important. It just gets a bad rap in conventional medicine. And so we see low cholesterol. Thiamine is needed goes through the pentose phosphate pathway. It supports, which makes NADPH, which is needed for cholesterol synthesis. And then, of course, malabsorption issues, fat malabsorption, those can contribute to cholesterol. But the synthesis of cholesterol, I work with things like manganese, running tests. We have to be careful with that one. Can cause a low cholesterol. So yeah, we see it in our kids, and we work to not just through the diet, but what's going on really deep in some biochemistry. Yeah, maybe I could look at another question here.
That's right.
Yeah, what do you do for tons of meltdowns and tantrums? That's a big one, right?
Always.
Oh my gosh. Well, again, we're running labs. Meltdowns and tantrums, right, in our kids. Behavior is communication. That's a child that's possibly uncomfortable in their body, could even have headaches, stomach aches, but not able to tell you. And so meltdowns and tantrums to me is something's going on medically, right? Kids, this is Dr. Ross Green, another favorite of mine. Kids do well when they can. Nobody wants to cause trouble. No one chooses to be in a bad mood. No one chooses to have a tantrum, right? There's some reason, right? Something that's causing that. And certainly there could be some different ways we approach behavior with our kids. I do behavior consults with families too. Dr. Stein has an excellent book and videos on behavioral positive support for behavior in our kids. So sometimes we have to take a little slower, a little different approach with our kids with Down syndrome. But meltdowns and tantrums, we got to look at, constipation, gut health, headaches, hydration, basic medical stuff. Something's going on. Gallbladder, right? Pain, right?
Yeah, I always say that when either with a patient or somebody on our podcast asks about behaviors. Look, if a child's screaming, they're communicating with you, okay? And that communication means I'm in pain. So if you have a child that's reacting out, they're hurting, and you've got to find out where that hurt is. And the majority of our kids, because they're predisposed to it, is gut infections and gut inflammation. So I always say go there first, whether you're constipated, you just need to move your stool, or you've got a gut infection that you've got to treat. In fact, today I had a patient, again, child, 7 years old, on the spectrum, had the behaviors. We ran a stool test. We ran it through LabCorp, so typical lab.
Yeah.
PCR showed 2 different E. coli infections and a calprotectin of 400. So massive gut problems, and it hurts. And you take somebody with a sensory issue where just cutting their hair or their nails hurts, and imagine just a little stomach pain for them. it's too
Right.
much. So they're communicating with you that they're in pain
Hmm.
by screaming,
Right.
or by tearing your hair out, or by cutting you, or scratching you till you bleed. They're
Yeah.
communicating with you in their way, so you've got to help the pain.
Right. And try to sleep when you've got a stomach ache or you haven't pooped in 2 days or something. Try to sleep. They torture people with lack of sleep,
Yeah.
right? And so so just not just the way it impacts sleep. Someone's asking here about folinic acid helping her daughter be more talkative, but now she has a B9 level in her blood. It was normal before folinic acid, and is it dangerous? I say, you can comment on, I say no, right? I never check, I almost never check serum folate levels. I look at everything else, right? Form-aminoglutamic acid on the organic acid test is a need for folate if it's elevated. We look at folate receptor antibodies. I'll look at, MCV, homocysteine, all those. Sometimes I'll do a serum folate or a red blood cell folate to see if they're flat out deficient. But if it's high, no, it's not dangerous. You do want to balance it with some B12. And some kids, too much folate or methylfolate can kind of, make them a little hyper and spin out a little bit. And so, but if your daughter is responding well, we look at kids. We're not treating numbers on a page, right?
Yeah.
And so, no, a high serum folate level is not, dangerous in and of itself. And so keep going if it's working. Yeah.
And I want people to know that most of these reference ranges on labs are based on what the lab sees as average. Okay.
Yes.
It's not defined as healthy. This is not a healthy vitamin level that they've researched. It's who comes in here, who do we test, what's their bell curve average. That's how those reference ranges are created. And something specific like folate or folic acid, is water soluble, and you're going to get rid of what you don't need.
Yeah.
So a high level on a lab is probably more healthy.
Yes, yes, correct. Yeah. Someone made a similar comment. They're giving liquid folate. There's many forms of folate, so that's hard to tell. I'm assuming you mean maybe folinic acid, but as you know, folate is the umbrella for all the different other forms of folate, which again, when you're testing a blood level, you're getting a folate level. And I want to know which form, what are we talking about here? It's really, complex. Do you mind? I'm going to ask there's another question I can see here. She's on a gut bundle. I'm not sure, for several weeks, not from a stool test, gut issues. I don't know. Is it too much in one drink? I'm not sure what she's giving here exactly.
No, that's all right.
Seems to give,
We've
yeah,
got what I normally provide for people when we're treating gut infections is
yeah.
this package of three
Yeah.
different supplements. One's an enzyme to dissolve
Oh, sure.
biofilm.
Okay.
Another one's some kind of antimicrobial like grapefruit seed
Yeah.
extract or colloidal silver, and then a binder.
Okay.
So that all
Love it.
together is fine. In fact, I would put it all together at least twice a day.
Mm-hmm. Yeah. Yeah. Wonderful. Yeah, it's great having those tools for families. I'm looking for ones that are kind of specific
That's
for
okay.
Down
I got one just popped up on my
Good.
end.
Good.
From Andrea, question. I'm wanting to order a lab test for my level 3 autistic 8-year-old who also has Down syndrome.
Mm-hmm.
She's gluten-free. What is the best test? I was thinking of the first one listed on the website, which is the oat test, heavy metals, but will that also give me results for yeast or parasites, or do I need to also do a stool test? I want to detox her and start her on supplements she is lacking. Also, do I need to stop her current probiotics and supplements before testing?
Do you want me to take that on?
Go for it.
Yeah. So organic acid testing. Yeah, I prefer to see it at baseline. So I'll have some parents who come in are giving a ton of supplements, which there's a place, right? But when I start with the kiddo and they're reaching out to me, so something's not working here. So I'll start them at baseline. I'll have them stop for about a week, unless there's something that parent says, no, this one absolutely they need, that changed them, helped them. And so I'll do an organic acid test at baseline with no supplements, and we start from scratch. And yes, it gives information about yeast, bacterial overgrowth. An organic acid test wouldn't give us information about parasites, of course, but a stool test. Those two together are just gold, right? The amount of information that we can help kids with just a comprehensive stool test, an organic acid test are really helpful. So yeah, so I recommend those to this mom.
Sounds good. All right,
Yeah.
let's wrap up. I've got one more question. We'll wrap up with this one because of
Yeah.
time. Jeannie says, my daughter seems to be very, very impulsive, almost ODD, oppositional defiance disorder. She just does what she wants to. My wife says that about me. She does whatever she knows you don't allow. Yeah, that's kids. They push our buttons. They play nice with a game, and then we put it away, and she goes to throw it, and she laughs, and she bites, and she pulls hair, and she thinks it's funny. Any suggestions?
100%. Yes. So very powerful, very simple tool. I don't want to belittle what you're experiencing with your daughter, but the power of ignoring, right? You have to look at your reaction. What is your reaction when you're doing? Are you giving a big reaction? Are you sitting down with her and explaining, we don't do that, and you're feeding it? Anything you do to feed these negative behaviors, there will be, if there's a negative behavior that you're looking to eliminate, right? And you're trying ignoring, want to keep everyone safe, right? So you do physically what you have to keep everyone safe, but you have to shut this off, right? Our children with Down syndrome love, right, this, it's stereotyping a little bit, but that social engagement is really strong for our kids. And if you don't feed it, it can be really helpful. There will be I believe it's called like a little burst, right? They might do it more and worse, but then once they realize they're not getting the response, it can greatly alleviate these, negative consequences, especially because she's laughing and it's a game to her and it's fun. Look at the work of Dr. Stein. His book is like right here. Positive Support for Children with Down Syndrome. It's reachable, it's with the hand's reach. He's got a great YouTube video on the similar topic. And I've listened to this video, I swear, like 30 times probably. These messages we have to keep telling ourselves as parents, especially to not react. Don't give them that big, strong reaction. Can be, really powerful, really hard to do, but really powerful. Yeah.
And it also feeds into what you mentioned before of dopamine, where people who have low dopamine are constantly seeking input. Now, that could be the TV, that could be the tablet, that can be that Kohl's 30% coupon I get in the mail. Whatever it is, I'm just looking for more and more and more, or I can go get that from people. I can go get drama. I can push my parents' buttons and look what I got.
Right.
So it's part of a addictive habit. So
yeah.
Well, we have to wrap up because of time. But Dr. Peirson, thank you for coming on, and I know the viewers loved it. And I really want to recommend, if anybody out there has a child with Down syndrome, has a child with autism, contact Dr. Peirson at peirsoncenter.com. Is it .com?
Yes.
Okay. Which is PEIRSON center.com. Any last anything for our parents?
No, I mean, just, keep, this is often hard work, but the rewards are big, right? I wish I could carry on about how well my son is doing, and he's an absolute testament to the power of this kind of work. And I honestly believe he wouldn't be where he is today. I'm not going to brag, but without this kind of work. Yeah.
And how many of our families' kids would be where they are today if they weren't the champion for their child and did everything possible instead of just hearing what the other people said? We're like, yep, you just got to deal with it. Yeah. So we're all our child's champions.
Perfect. So, yeah.
All right, Dr. Peirson, thank you very much for coming on. It was great to have you here on the podcast, and thanks for everybody listening, everything you do for your kids, and we'll see you next week, everybody.